Parathyroid surgery generally involves a small incision in the lower neck, just above the notch in the breastbone. Typically, most parathyroid surgery can be done through a small incision right about the size of my thumb. There are two different types of parathyroid problems that can cause overactive parathyroid. The one that everybody generally reads about on the internet is called an adenoma, or a nodule that grows on the parathyroid. Those are benign or non-cancerous. Generally, in that case, there can be a small nodule growing on the back of one of the parathyroids. That means we need to remove the entire gland. In this day and age, there's also a second type of parathyroid problem that we see called hyperplasia. That means that all four glands might be slightly swollen or a little bit overactive or overgrown. When that's the case, we sometimes remove more than one parathyroid and can trim down to the best parathyroid. You still have to go home with a parathyroid. They're very important to calcium balance. But we can sometimes pick the best parathyroid or even move a piece of parathyroid to make sure that you have a good balance. About a third to half of people that we see today have more than one parathyroid involved, what we call hyperplasia. That means that more than one parathyroid is overgrown and may be hyperactive. We don't know if this is genetic or environmental or some combination, but in that case, generally more than one parathyroid needs to be removed. Sometimes we can remove 2 to 3 parathyroids or even trim the fourth one, but it's very important to have some parathyroid tissue for good balance.